Well, everyone's a candidate for lip filler. Everyone can have filler because why not? You're allowed to. We try to make it look like it's naturally big versus that big migrated ducky look. So if you've never had lip filler before and you're scared, this is what you should know. Hi, we're talking all about lips today. Lip filler, if it's right for you, and things that you could do that are not gonna have needles involved, such as lasers or toxins or even just skin boosters. So by the way, I'm Dr. Jessie Cheung, if you don't know who I am. Hi. So lips, we love lips because it's a quick way to boost your confidence and feel just a little bit more fun and flirty. So the lips are actually muscles that, move when we talk, right? And so as we age, what happens is the lips start to get thinner and saggier. And if you were not blessed to be born with great lips, well, you can always treat them when you're not that old. So what do we do normally? We like to use fillers to plump and hydrate the lips. So basically it'll help to give you shape and definition, help the Cupid's bow, help the lips either come more forward or be a little bit more setting up like this. You use fillers to shape and plump and also add the hydration. We also use a Botox to help to flip the lip, which helps the wrinkles in this area, but it'll give you more plumpness and poutiness without making you not be able to talk or use a straw. You can also use lasers to plump the lip naturally. We actually just zap the lips, very easy procedure, it doesn't hurt that much, it's very warm, it's very comfortable, but that actually helps to build the collagen and elastin, it helps with the blood vessels in your lips. So it actually gives you plumpness and firmness and lasts much longer than filler actually. So how do you know if you're a candidate for lip filler? Well, everyone's a candidate for lip filler. Everyone can have filler because why not? You're allowed to. We just choose the right type of filler for your anatomy and your lips. So if you're someone with very thin lips, we're not gonna use a big bulky filler because that'll look really strange and look really stiff on you. But a nice soft flexible filler that's gonna move with your actions. If you're someone who has a very big dramatic lip, we'll use a bigger, thicker filler to give you that drama. So we do see a lot of overly stuffed lips with like migration, ducky lips that just look really fake. We don't like that because it just doesn't look right. Because when you see that face, it's like, whoa, they've had filler that may not be great. So you want a nice, subtle lip that looks very natural. Some patients want to go bigger, less natural. That's totally fine too, but we try to make it look like it's naturally big versus that big migrated ducky look because that looks very fake. So if you're afraid of unnatural looking filler, the best filler is undetectable. We don't want to give you detectable filler. So most lip fillers that we like to use in America, they're made out of a sugar gel, hyaluronic acid. That's the same hyaluronic acid that's in our joints and our skin to help with the plumpness and moisture. It's just a little bit more structural when we inject into your lips for shaping and for firming. But it does go away eventually as we get older, that hyaluronic acid. Ooh, how do they work? So hyaluronic acid actually binds water in your skin to really plump it up. So hyaluronic acid is natural state, it looks like cotton, looks like little white puffy balls. When you add cross-sticking and hydration water to it, actually looks like a gel, very soft gel, like a jelly that we're putting into your lips to make it look soft and pouty. Each side of your lip should be a twin. So if you have a pre-existing asymmetry, some people do, we'll fill one side more or we'll put more tox on one side. But yes, your lips, when you fold them, should be symmetrical. It's kind of hard to do in real life, but we want them to match, to look natural. So if you've never had lip filler before and you're scared, this is what you should know. Most people will want to do a topical numbing cream because yes, it's needles going into your face. You could do a dental nerve block. That's an injection that dentists do to make your lips really, really numb, and that works really well because you're numb for about 30, 40 minutes. They'll talk a little funny because you can't feel your face, but that's okay. You can still eat and drink and stuff. So most of my patients like to do both a dental nerve block plus topical numbing cream to make you super numb because I don't want you moving when I inject you because that may lead to bruising. And then we kind of lay it back. We put the fillers in you with needles or cannulas. You may have some bruising, you will swell because lips is very delicate tissue. Anytime we touch lip, it's going to want to swell. Swelling's the worst the first 2 days. You might look a little more ducky and strange because of the swelling, but we can give you prednisone pills to help with swelling. We can take antihistamine pills. You can just ice, that helps a lot with swelling too. But just know that you'll have a little bit of downtime, bruising, swelling, because that's anytime we touch you with a needle, it's going to want to get puffy. So risks and side effects of fillers. Anytime you put a needle into you might have some bruising and swelling. We want to fill the right level of your skin, so we don't want to have migrations. We don't want to cause a necrosis. That happens if you put the filler into a blood vessel. That's important to feed the tissue of your face, so we don't like those complications. The good news is you could dissolve hyaluronic acid with an enzyme called hyaluronidase. We inject that enzyme immediately to dissolve any filler that we don't like. So if you want to plump your lips, there are options besides using needles. We can actually use lasers to plump your lips and help with the definition. Actually, it's a popular treatment. We call it lip laser. So we take a laser, and the heat of that laser actually causes collagen and elastin to build in your lips to plump them up naturally and add the hydration back. We also use lasers to define the lip line because as we get older, that lip line gets a little bit less distinct. So we have really fun tools for that. With not much downtime, you're gonna be a little pink, a little dry, put your lipstick on, your chapstick on, you look good to go. You can also Botox the upper lip over here to help with the wrinkles and to help to kind of give you more eversion, to kind of give you a little plumping and a pout. When we think of lips, though, think of it like we want to stay proportional to your facial, proportions to keep you looking natural. So don't overlook the around the lips. So you want to work on the wrinkles around the lips, the texture. Because we're going to say, some people, a lot of my older women come in and they think that all they want to fill is their lips, but we're like, no, look at the cheeks, look at the jaw, look at everything else. If you just fill this, it's gonna look great, but you're not gonna match the rest of your face. That's the important part. So if you're someone who likes instant gratification like me, I like instant gratification, fillers will get you there very quickly. You'll have a little bit of downtime, some bruising, some swelling for maybe a couple days, but really not bad after that. If you're someone who wants to do slow, subtle, you can totally laser your lips. We use two different devices. One's by Photona, we call that lip laser. The other one's my Exion device, which is gonna increase the hyaluronic acid in your skin to really plump them up and make them juicy. Those are both non-invasive, no minimal downtime. You're a little pink, a little puffy afterwards, a little dry maybe, but you look very normal. It's gonna build the lip slowly, so no one's gonna come to you and say, oh my God, what'd you do? But it's really nice because it's your own face. You're owning your lips, not just renting them temporarily. So skin infusions for your lips. So I have micro infusions in my lips right now. Basically, we're putting things very superficially to help with hydration and texture and plumping. So you can do skin infusions into your lips to give them a little bit of a natural plump and to help with the hydration. I think if you're looking for someone that you want to trust your face with, look for experience and education. I've been doing things for probably more than 20 years. I am older than I look. But you want someone who knows what they're doing, knows the anatomy, knows the potential complications, know other ways around the different fillers too. You know, lips are not the hardest thing to fill, but to make them look very natural, that does require an artistic eye. So look for education and experience. If you have any questions about your lips, you can comment down below, or you can click on the link in the description and book a consultation.